30 years ago, there were very few heart attacks, but now why are there more and more? Xiao Wu is 36 years old and has always been in good health. Last Wednesday, he suddenly felt unbearable pain in his right lower jaw, as well as severe chest tightness and nausea. At first, he didn't pay much attention and thought it was just a toothache, so he took a pain-relieving pill on his own, but the situation didn't improve. The pain gradually worsened, not only affecting the entire lower jaw, but also radiating towards the left arm, causing rapid breathing. Upon seeing the situation, Xiao Wu's family immediately decided to call the emergency number. When he arrived at the hospital, Xiao Wu was already in a state of hypotension shock, and his condition was critical. Doctors and nurses quickly began treatment. Xiao Wu's electrocardiogram, ECG, shows significant ST segment elevation, which is a typical manifestation of myocardial infarction. The doctor immediately performed emergency treatment for Xiao Wu's myocardial infarction, including administering anticoagulants and antiplatelet drugs to prevent thrombus formation, and arranging coronary artery catheterization surgery, coronary angiography, to determine the location of the infarction. However, during the coronary angiography process in the operating room, Xiao Wu's condition deteriorated sharply and his heart stopped suddenly. Medical staff quickly perform cardiopulmonary resuscitation, CPR, and use an automatic external defibrillator, AED, for defibrillation. Despite trying his best to save for more than 10 minutes, Xiao Wu's heart couldn't recover and unfortunately passed away. In the subsequent analysis of the cause, doctors found that Xiao Wu's toothache was one of the symptoms of myocardial infarction, which was misunderstood as a common oral problem. In fact, he had already experienced symptoms of myocardial infarction when he felt toothache, but did not seek emergency treatment in a timely manner. According to the latest statistical data, cardiovascular disease has become the leading cause of disease mortality in China. Currently, there are about 330 million cardiovascular disease patients in China, which means that 1 in every 5 adults is troubled by cardiovascular disease, and out of every 13 cardiovascular disease patients, 1 person suffers from myocardial infarction. Acute myocardial infarction, commonly known as myocardial infarction, is the most severe type of coronary heart disease and poses great harm to patients. Why does a sudden heart attack occur? There are many reasons leading to acute coronary artery occlusion, the most common of which is the rupture of atherosclerotic plaque on the coronary artery wall, followed by the formation of acute thrombus, which leads to complete or partial occlusion of the coronary artery. In addition, severe coronary artery spasms, spontaneous coronary artery dissection, plaque erosion, etc. can all lead to accidents. People with coronary heart disease risk factors, even if they do not have symptoms, should be highly alert to the possibility of myocardial infarction if they experience persistent chest tightness or pain. In recent years, more and more people in China have been suffering from myocardial infarction, especially among young people, which is gradually increasing in incidence. Why? Yang Jing'ang, Deputy Chief Physician of the Cardiovascular Department of Fuwai Hospital, Beijing Academy of Medical Sciences, analyzed 3 main reasons. One reason is that young people have limited understanding of the symptoms of myocardial infarction, and once it occurs, they often do not realize that it may be a heart problem. Secondly, before young people develop heart attacks, there are usually specific triggers, such as consuming a large amount of food, excessive smoking and drinking, staying up late to work or working overtime, and playing mahjong for a long time. After experiencing discomfort symptoms, they may mistakenly believe that it is caused by fatigue or alcohol consumption, which may delay the opportunity to seek medical attention in a timely manner. Thirdly, compared to patients with chronic coronary heart disease, young people usually do not have sufficient collateral circulation to provide additional protection for the heart. This means that when acute coronary artery occlusion occurs, they are more susceptible to the impact of myocardial ischemia, and myocardial injury may be more severe. It should be noted that myocardial infarction is more likely to occur in these high-risk groups: those who consume heavy oil and salt, smokers and alcoholics, those with high mental stress, those with abdominal obesity, sedentary individuals, and those with 3 highs. Before the onset of myocardial infarction, it is usually accompanied by a series of symptoms, among which 50% to 81.2% of patients will first experience new onset angina or worsening of existing angina. The initial symptoms of patients are usually pain similar to angina, with a location and nature similar to typical angina, but the causes of pain are usually not obvious. As the condition progresses, pain may become severe and accompanied by systemic symptoms such as fever, rapid heartbeat, increased white blood cell count, and increased erythrocyte sedimentation rate. In addition, 75% to 95% of patients experience arrhythmia before onset, with ventricular arrhythmia being the most common. In some severe cases, arrhythmia may lead to serious consequences such as hypotension, shock, and even heart failure. In fact, the onset of myocardial infarction is traceable, and the symptoms will change over time. 1. A few hours or days ago. Early symptoms usually include chest tightness, feeling the need to exhale, chest pain, palpitations, and difficulty breathing, abdominal pain, gradually worsening and expanding in scope, toothache, especially when it intensifies after fatigue or excitement, may involve multiple teeth, symptoms such as unexplained nausea and vomiting. If you have recently experienced these symptoms, you should be highly vigilant and seek medical attention as soon as possible. Taking timely measures can prevent the onset of myocardial infarction. 2. First hour. At this stage, patients may feel that the aforementioned symptoms gradually worsen, which may mean that a coronary artery in the heart is about to be completely blocked and the myocardial ischemia situation worsens. To avoid the onset of myocardial infarction, it is necessary to immediately seek medical attention at the hospital. 3. At the onset of the disease. During a heart attack, patients may feel chest pressure, difficulty breathing, excessive sweating, and even feel on the brink of death. In this situation, it is important to maintain quiet rest and immediately call the emergency hotline to request emergency assistance. Rapid measures need to be taken at this stage, and time is crucial for the treatment of myocardial infarction. If there is no one around to help during a heart attack, one should also learn to self-rescue. Immediately call 120 emergency hotline. Immediately stop any physical activity and it is recommended to rest flat on the bed or ground. Proactively control tense emotions and try to remain calm. If an oxygen cylinder is available, oxygen can be inhaled to help alleviate symptoms. Do not take any medication on your own. Some patients with myocardial infarction may experience hypotension, so do not self-medicate. If there is a blood pressure monitoring device, it can measure blood pressure, but do not blindly use medication. Protecting blood vessels and preventing myocardial infarction attacks. Good daily routine. If you want to protect your blood vessels, you should also pay attention to going to bed and waking up early in daily life, and have a regular routine to enhance metabolism, eliminate toxins and waste, promote blood vessel patency, and prevent the occurrence of acute cerebral infarction, myocardial infarction, and other problems. Good diet, long-term intake of high salt, high sugar, and greasy foods can also lead to elevated blood pressure, elevated blood lipids, induced vascular blockage, and increased blood concentration, which increases the risk of myocardial infarction and cerebral infarction. Therefore, it is important to pay attention to a light diet in daily life. Good mood. If one is emotionally unstable for a long time in daily life, besides causing a sharp increase in blood pressure, it can also stimulate vascular damage, leading to the risk of stroke and myocardial infarction. Therefore, in daily life, it is important to pay attention to ensuring personal emotional stability and maintaining an optimistic attitude. Good water temperature. For some cardiovascular disease patients, it is also important to pay attention in summer. Do not indulge in coldness just because it is too hot. Taking a cold shower or an overheated bath can stimulate blood vessel damage, leading to the onset of acute cerebral infarction and myocardial infarction. Therefore, it is better to control the water temperature at 38 degrees Celsius as much as possible. Check well. For some patients with hypertension and diabetes, it is also necessary to pay attention to actively control blood pressure and blood sugar, regularly carry out relevant re-examination, and check their own indicators. To a certain extent, this can have a protective effect on blood vessels, prevent the risk of myocardial infarction and cerebral infarction, and cause the greatest harm to the body. Therefore, it is also important to pay attention to regulation in daily life.